In recent weeks, members of the Canadian Armed Forces have been helping out in long-term care facilities and seniors' homes in Quebec and Ontario. Ontario and Quebec have asked us to extend the Army's mission, and as I said yesterday, our government is currently discussing that with them. Our members are doing an outstanding job to help our grandparents, our parents, and our seniors during this crisis, and I want to thank them. This is not an easy job or an easy situation to handle. This morning, the Government of Quebec made public a report produced by our members where they raise a number of serious issues. A number of the observations in the report, such as inadequate staff, are among the reasons why Premier Legault asked for the armed forces to provide support a month and a half ago. These are serious issues that deserve to be brought to the attention of Quebec, and we passed on the report to them last evening. I also spoke to Premier Legault earlier this morning, and I reiterated our support. And tomorrow evening, I intend to raise the issue of conditions in seniors' homes and long-term care facilities when I have my weekly call with the premiers of the provinces and territories.
I plan on raising what's happening in nursing homes and long-term care facilities with the premiers during our weekly call. I will once again offer our government's support as they try to get the situation under control. As I've said many times, we need to do a better job of caring for seniors. They raised us, they built this country, they deserve better. During the first few weeks of the crisis, people's lives were turned upside down. Hundreds of thousands of Canadians lost their job through no fault of their own, without warning, because of this pandemic. It put enormous financial pressure on everyone from students to young professionals to families. So we brought in the Canada Emergency Response Benefit to support people until they're able to get back to work. And to help as many Canadians as possible keep their jobs or get hired, we introduced the Canada Emergency Wage Subsidy. We also unveiled our $9 billion plan to help students and recent grads get through the next few months. We now have over 45,000 jobs available for young people. If you or someone you know is interested, go to jobbank.ca to apply. Now, as provinces and territories restart some activities and many people head back to work, fewer people will need the help of the CERB. But the wage subsidy will continue to be there to support Canadians and make sure they can get paid their salaries. Maintaining the connection between employer and employee is key not just to helping people get back on their feet, but to keeping our economy strong. That's why it's so important that employers take advantage of this program and rehire workers.
In the first few weeks of the crisis, people's lives were turned upside down. Overnight, hundreds of thousands of people lost their jobs because of the pandemic. This placed a lot of pressure on families, young professionals, students, and many, many more. So we brought in the Canadian Emergency Benefit to support people until they could return to work, and to allow even more people to keep their jobs or to be hired. We set up the emergency wage subsidy. We also unveiled a $9 billion plan to help students get through the next few months. More than 45,000 job offers for young people have been posted on the government's website. In order to apply, go to jobbank.gc.ca. We're starting to see activities start up again in the provinces and territories, and that means that people will have less and less need for the emergency benefit. The emergency wage subsidy, however, will continue to be there to help Canadians during the recovery and ensure that employees are receiving suitable pay. Maintaining the connection between employers and employees will also help us to ensure that the economy is strong. If you are an employer or a business owner and you have not yet applied, I invite invite you to go to the Canada Revenue Agency's website to do so. I've been saying from the beginning that in order to come out of this crisis, everyone must do their part. To save lives, people must continue to practice physical distancing. To get the economy back on its feet, people have to work, and businesses must have customers. So if you're an employer, do rehire your employees. Our government can and will help you. I will now take your question.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions par le téléphone aujourd'hui. Opérateur, c'est à vous.
Thank you. Merci. Première question. Marie Vastel, Le Devoir. À vous.
Good morning, Mr. Trudeau. With respect to the report on Ontario and Quebec's long-term care homes, I'd like to come back to your offer of assistance to the provinces. I know that you've already said a few times that you will respect a provincial jurisdiction, but you also said that you want to help. So are you thinking of doing what the Liberal government in Quebec did before to ensure that specific funds go directly to these seniors' homes? Well, those are the types of discussions that have to take place among premiers. For the time being, our priority is to ensure that the help that is needed now within that system, either through the armed forces or other means, will be there. So right now, we are seeking to help those facilities and seniors' homes to do better in agreements with the provinces. But over the longer term, we have to look at how we can move forward as a country to support our seniors after the pandemic. And we will be there to be part of those discussions.
Obviously, we need to make sure that in Canada there is a better job of supporting our seniors, particularly in long-term care centres. That's why we are there to help, and we've offered to help with the provinces. We will, of course, always respect provincial jurisdictions, but we will be part of those conversations. In the immediate, we need to make sure that help is improving, that help is getting to people who need it and to centres who need it. That's why we're there with the military and why we're looking at other ways of helping in the short term as well. But for the longer term conversations, well, those need to be had, because coming out of this pandemic and into the future, we need to make sure we're doing a better job of supporting our seniors, and the federal government is there to work with the provinces while respecting their jurisdiction.
En suivi, Marie?
Follow up? Thank you. At the same time, you say that you want to respect provincial jurisdiction. Are the provinces really open to have specific measures taken, or to be told how the money they receive should be spent? And on the CERB, you've been telling people to move on to the wage subsidy. But will you extend the CERB, or will it end on the date that's already planned? Well, as I said, we continue our discussions with the provinces, and I believe that all levels of government, including municipal governments and Indigenous governments, are feeling the pressure of their citizens to improve the services provided to our seniors. And of course, we will be listening to Canadians' concerns about this, and we will have to work together to improve that system. But I can't speak for the provinces at this time. And with respect to the programs, I think it will be important to put a reasonable end, to provide for a reasonable end to some of these programs. Of course, we had to help people who had lost their income. And of course, we had to ensure that people could get through this crisis as best possible. And that's what we did. But of course, in terms of moving towards an economy that's recovering and employers that are starting to rehire their workers, we will be looking at the best ways of making that transition, and we're currently in discussion with other levels of government and workers' organizations and unions and employers as well to talk about that.
We all know that the gradual reopening of our economy will require a phasing out or an ending of certain programs and a continuation or modification of others, and those are things we're looking very carefully at. We are still very much in the emergency phase, in the crisis phase of this, even as we're seeing careful reopenings. We need to make sure we are continuing to protect vulnerable Canadians and ensure that we're controlling and stopping the spread of COVID-19. We will, however, look very carefully at how we end certain programs, how we modify others in order to get our economy going again to where it was before or even better.
Thank you. Operator, next question.
Thank you. Merci. The next question, Cormac McSweeney, CB News Rogers Radio. Line open.
Yes, Prime Minister, I'm just wondering that given that advocates have said that the problems with long-term care are not new and they are widespread across the country, and that you yourself have said that it's not limited to the facilities that the military is currently deployed in, is it time for a national inquiry into long-term care facilities in Canada?
I think right now, while we're in this crisis, our responsibility is to respond to this crisis as best we can and to ensure that we are improving in the COVID context care as best we can. But absolutely, we need to have conversations about how we care for our elders in this country, right across the country, and respecting provincial jurisdiction, respecting that there are areas that have greater success and fewer problems than others, means that we will need to be very careful and very grounded in the facts on the ground as we look to moving forward.
And I have a question.
We all know that, yes, there are challenges in our long-term care homes, but there is also a lot of variation between the provinces and even within the provinces. So we will be working to provide assistance right now in the midst of this crisis, but obviously the conversations and a more in-depth review of what needs to be done will be critical in terms of moving forward.
And a question from a colleague at 680 News in Toronto. I'm just wondering, New Zealand has floated the idea about a 4-day work week and extra statutory holidays post the COVID-19 pandemic to try and boost the economy. I'm wondering if you would consider the same thing for Canada, if that's something that you think would work for our country.
I think there are a lot of people thinking creatively about what the post-COVID world could look like, and I look forward to hearing a wide range of suggestions. But right now, we're very much focused on getting through this particular crisis, and we'll have plenty of time to talk about particularly creative ideas on moving forward, but I'm not going to speculate on what any of them might be.
Merci. Opérateur, prochaine question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Bonjour, Mr. Trudeau.
Good morning, Mr. Trudeau. I'd like to come back to the Army's report on facilities in Quebec. Did you read it, and what do you think of it? What struck you in that report? Well, yes, I did read it last night, the entire report. And of course, there are some very concerning issues that are raised. The fact that the separation between the different zones is not being respected, and staffing as well. And these are the reasons why we needed the armed forces to go in and assist. And through what I read last night, I must admit I felt tremendous pride in the professionalism of our armed forces members who are there to help with a system that is in difficulty right now, and to protect the most vulnerable Canadians. Of course, there were some troubling observations in there, but at the same time, we realized that we really needed to be there for each other, and that there will need to be improvements made to the way those facilities operate.
I was able to read the report last night in its entirety in regards to Quebec. Obviously, there are many things that were troubling that highlighted the very need that we had to send in our armed forces to help, whether it was lack of personnel or difficulty in following the strict separation and isolation and PPE rules. There was a need for our Canadian Armed Forces, and it certainly filled me with a tremendous amount of pride and even deeper respect for the professionals in our armed forces who have made such a positive difference in a short amount of time in some systems that were really in need of extra assistance. Obviously, there are difficult things that we need to continue on, but we've seen significant improvement in many of those centres, and there continues to be a need for us to work together, and I certainly spoke about that this morning with Premier Legault in our conversation.
En suivi, Mélanie?
Follow up?
Oui, dans un autre dossier,
Yes, on another subject, Mr. Trudeau, there's a very important decision that is going to come down out of the Supreme Court in British Columbia. If the court rules in favor of Meng Wanzhou,
le gouvernement du Canada sera-t-il appel?
will the Canadian government appeal the decision? We're a few hours away from that court's judgment, and we will wait to see it before we speculate on the next steps or our potential decision.
Thank you. Merci. Next question, Teresa Wright, The Canadian Press. Line open.
Good morning, Prime Minister. Experts and advocates who have been raising red flags about the long-term care system for years are calling for immediate federal leadership, including national standards and guidelines. What is your immediate plan to deal with these systemic issues at the federal level now that the military has confirmed what many people have known for years?
Well, the immediate plan is to help out immediately. That's what we're doing with the military. That's why we're working very closely with the provinces on looking at how we can ensure that they have the resources needed to get these care centres properly serving the elders who they care for. There are many things that we need to work on right now, but of course, there will be many important discussions going forward on how we establish a better system in Canada. And I'm not going to short-circuit that conversation by putting forward aggressive proposals right now. But all I will say is the federal government is there to support and to work with provinces to ensure that in areas of their jurisdiction, they are able to give Canadians the care that they and their families expect.
What we need to do now is help and ensure that in this crisis, in the midst of this pandemic, we have the necessary resources to care for our seniors across the country. And the federal government will be there to be a partner to the provinces while they regain control of the system. Now, of course, with respect to the longer term, we must have in-depth conversations about how we can ensure that we have a better system to support Canadians and reassure their families about the care, the level of care being given to their parents and grandparents. So we will be having those discussions at the appropriate time with respect to the appropriate action.
Yes, thank you. Mr. Prime Minister, your government is currently engaged in an unprecedented peacetime expansion of government spending and powers. At some point, shouldn't Canadians be allowed a vote on the choices you are making and given the opportunity to say in a democratic fashion whether that's the path they want this country on?
I haven't heard a lot of Canadians demanding an election right now, but obviously in a minority parliament, Parliament gets to decide when it no longer has confidence in the government. And certainly the focus we have moving forward is trying to respond to help Canadians as best we can in the immediate. This is a time of a certain crisis for Canadians, and that's why we have made unprecedented investments to support Canadians to get through this challenge. But there will be many challenges that we will face over the coming years as to how we improve the Canadian economy, how we make better digital changes, how we move forward on a greener and cleaner economy, how we support our most vulnerable in better ways. And there will be many debates in Parliament and eventually in an election. But I'm not going to speculate on when that might be.
I think Canadians know that our government is there to help people who need help now. We need to do everything we can in order to get everyone through this crisis quickly so that we can ensure we have a strong economy and a properly functioning society. And there will be proper time to think about the longer term and how we can take the lessons of COVID-19 when it comes to caring for the most vulnerable, when it comes to a more digital economy, a greener economy. So there are many, many things we will have to be thinking about as Canadians, and there will be political debates and elections to be held as well. Now, with respect to an election, we are in a minority situation, so Parliament will decide when they no longer have confidence in the government. For the time being, I continue to govern for all Canadians.
Prime Minister Chris Logue with Global News. What do you think of the particular part of the military's report on Quebec long-term care homes that states they were keeping residents who tested positive for COVID-19 in rooms with those who tested negative?
Obviously, the report highlights a number of preoccupying issues, and the military has acted with tremendous professionalism, not just in writing a report and sharing it, but on acting on the ground with administration of the centres, with partners to ensure that procedures are improved. We are extraordinarily lucky to have the amazing professionals in the military who are helping out and protecting Canadians, but this is what they do. They take risks and they keep Canadians safe, and we are lucky to have them.
And what specifically will the federal government do to support the provinces in overhauling the system, ensuring proper staffing and accountability to stop this from happening in the future?
Obviously, we need to do things right now, and we are doing things now to ensure that elders across the country get the care they need in this COVID crisis. But there will be a need for much longer conversations about how we move forward, and we ensure that right across the country, all of our elders who contributed so much, who built this country, get the proper care that they so richly deserve.
Bonjour, Monsieur Trudeau. Louis Blouin de Radio-Canada. Sur la question
Radio-Canada. On the matter of a national public inquiry, I'd like a more specific answer. Is that one of the options you're looking at? And what could the federal do under the circumstances not to interfere with the province's jurisdiction? Or do you think you could hold an inquiry without presenting a risk to that? Well, I think in these two reports on Ontario and Quebec, we saw startling differences between the two situations. There are provinces that are facing more challenges than others, and I heard Mr. Ford, and I believe we will be hearing from Mr. Legault today with respect to their perspective on the report and what they believe they need to do. We will be there to support the provinces as they reflect on this, and we will be there to participate wherever possible and based on needs. I'm not taking anything off the table at this time, but I do respect provincial jurisdiction, and we will be there to support the provinces as they try to regain control of their systems.
I think we know that we need to work together to move forward and ensure that our elders are getting the proper care. But the situation does vary across the country from region to region, from province to province, and we respect the provincial responsibility to get these situations under control. But like I said, we will be there to help in ways that we're needed to do. If there is a need for greater federal leadership, we will certainly respond to those requests. At the same time, everything is on the table as we move forward. We know Canadians expect us to do better by our elders, all of us, and all orders of government, and we will ensure that we do.
Je vais vous poser une question sur les travaux
parlementaires. I'd like to ask about parliamentary work now. The opposition is accusing you of lacking transparency. Even the parliamentary budget officer was saying that 4 hours isn't very much to be looking at all the federal aid programs. Now, do you think it's now time to be limiting debate in Parliament where you're bringing in historic spending programs? Well, on the contrary, we have significantly increased, in fact doubled, the amount of time allocated each week to the question period, not just on COVID-19, but on all sorts of other issues. I think it's important that during a crisis, we have a functioning parliament, that we have democratic institutions doing their job, and we will continue to be open and transparent. And Parliament decided to move forward with a hybrid approach that I'm looking forward to seeing this afternoon, that will allow members of Parliament in the chamber and in other regions of the country to ask questions and raise the concerns of their constituents. I think that this is a very positive measure for the country as a whole when it comes to ensuring the proper functioning of our democracy in a crisis.
I think it's extremely important that we continue to have a well-functioning parliament and functioning democratic institutions during this crisis. Over the past weeks, we've been sitting 3 times a week, twice virtually, once in person. But going forward, we will now sit 4 times a week, and there will be more than double the usual time for questions from MPs. And MPs not just in the House, but MPs right across the country. With the virtual parliament, hybrid parliament, we're moving forward with MPs who represent far-off places in this country who aren't able to come physically to Ottawa will still be able to ask the questions that their constituents expect them to. This is a way of demonstrating that we are moving forward on upholding our democratic principles and our institutions, not in spite of a crisis, but because of this crisis.
Hi, Prime Minister. Tom Parry, CBC. You're going to be talking to the premiers about the situation in long-term care facilities. Would you be prepared to increase Canada Health transfers to the provinces and territories with that money going toward these facilities to improve the situation there?
We've already increased the Canada Health transfers. We transferred $500 million to the provinces at the beginning of this pandemic to help out with the extra costs we knew that were coming. Our focus right now is on making sure that we're doing everything we can right now to help during this particular situation. But of course, going forward, Canadians want to see us doing better by our elders right across the country, even beyond this pandemic. And we're going to be there to work with the provinces on the right way to move forward. Okay.
We increased healthcare transfers to the provinces to the tune of $50 billion before this pandemic so that the provinces could address the most urgent needs associated with COVID-19. And we will be there now as well to help in many different ways over the medium and longer terms. We will be having necessary conversations as to how we can better help our seniors across the country.
I've asked you to extend the military mission to the long-term care facilities. Given what the military has uncovered in some of these places, how long do you think they're going to have to be there, and what conditions would you want to see before you pulled them out?
Well, I think we definitely need to see situations improved. As we saw in the Quebec report, there are significant improvements over the past weeks in those situations, and in a number of them, the military is ready to pull out or move on from those particular instances. I think the discussions that we're having with the provinces right now is really about how we will move beyond the need for military support, how they will get their systems back under control without a need for federal intervention of having soldiers in our seniors care centers. We are happy to be there, and it is extremely important, obviously, that we be there during this crisis. But it's not a long-term solution, and we need to make sure that we're working carefully with the provinces to ensure that they are able to solve for this problem for the medium and long term, and we will work with them on that.
I think we all understand that having soldiers in our long-term care facilities is not a solution over the medium or long term. It is a short-term solution, and we're very happy to be there, and we have seen just how important it was that we be there, and we will continue to provide that support. But at the same time, there must be a discussion with the provinces as to how we can move beyond this step of emergency assistance from the CAF so that they can regain control of their own systems in the appropriate manner. I think we all know that the military in such a situation, I mean, we're very lucky to have the military, but it's not a long-term solution.
Ian Wood, CTV News. Prime Minister, I just want to revisit the question of immediate steps that your government is going to take with regard to long-term care homes. You've mentioned the military being there already and phone calls with the premiers. Doug Ford's asking for more financial support. Is it simply a question of money for you?
It's a question of making sure that our elders are well taken care of right across the country. This is something that matters deeply to Canadians, and it's something that we will ensure that that happens. We're working with the provinces right now on making sure they have the resources necessary to serve our seniors in the right way. But of course, as we move forward, we will need to continue talking about this and figure out more longer-term solutions.
President Trump is keen on holding an in-person G7 meeting. Is that a good idea from a public health standpoint, in your opinion? And are you going to attend?
It's not a question of my opinion on public health standpoints. We are going to be discussing with public health public health experts, and discussing with the U.S. administration what their plans are and how they're responding to questions around transmission, questions around would we then as leaders have to isolate when we return, which is right now the rule in Canada. There are significant health preoccupations that we have around holding an in-person meeting, but there's no question that in-person meetings in an ideal situation are much more effective than even virtual meetings. However, there are many questions to answer before we can commit to showing up in person, and those discussions are happening in an ongoing and very constructive way. With
and if he pushes ahead with an in-person meeting, will you attend?
We will continue our discussions with the Americans, and we will abide by public health recommendations. Évidemment, nous allons toujours
of course, we will continue to be focused on the public health recommendations. With respect to an in-person G7 meeting, we will be looking at the U.S. proposal and working with it to see what proposals, what provisions will be in place, and whether there would need to be self-isolation when returning to Canada, which is the case for anyone else coming into the country. So these are all issues we will have to look at carefully. And of course, a G7 meeting is very important, and I would prefer to have it in person than virtually, but there are health considerations that must be taken into account, and we are continuing those discussions.
Okay, there is the Prime Minister.